Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me from Community Counselling Services is Keenan Wald from Lowndes County Administrator and Ray Evans, who's the Noxby County Administrator. And today we're talking all about community counselling services and the commitment process. Listen up, everyone. This is really interesting. Why do we actually need this to begin with, my friend Ray? And what is a civil commitment? I know what it is, yes, but explain it in layman's terms for our audience at home.
The civil commitment process is the process by which a family member or a caring friend can actually force someone into treatment when they may not necessarily want to go into treatment.
All right, I want to ask you the wording force.
Yes.
Okay, now, does that mean what we see in the movies? The ambulance arrives, no, we're putting them in straitjackets, doing this horrible, inhumane issue and intervention-wise. How does this work?
The process works, it would start with the Chancery Clerk or Chancery Court, and then they would be evaluated by a therapist and also 2 medical doctors. So it's just not a person saying that an individual needs to go into treatment. It has to be verified. All
right. I want to ask you, when this is done, does the person who did the civil commitment, say me, and I'm wanting my wife to go into counselling, but she is refusing, does that mean I have total control over how long she's in there and things like that?
No, the court typically will, once evaluation has happened, if
right,
they decide commitment's going to go through, you're really looking at between 30 and 90 days.
Right.
If an inpatient facility is recommended.
Okay. So that clears a lot up for a lot of people at home, because when you do a civil commitment, those words do scare people, and it's almost like they can't get out. Okay, what are some of the costs involved in this, especially when we're talking in-person commitment?
There is a minimum cost to the individuals filing the paperwork, and that cost is about $150.
That's all?
That's all.
And what about the cost of in-house treatment?
The cost of in-house treatment, the state or the county picks that up. So that's not a direct cost that the family will incur.
This is wonderful.
Yes.
I had no idea about that.
Yes.
I think that's great. And it allows people who can't necessarily afford to go into these facilities that, guess what? There is someone out there that can help you with that as well. Let's talk about what happens after the judge does the commitment. What's the next step?
They are transported to the institution when a bed is available.
Right.
And they get the care and the treatment and whatever they may need at that time. And then when they come back, they are integrated back into the community system. And so for us, that's community counseling services. So they come back, they get a counselor, get a psychiatrist, if they don't already have that connection. And hopefully it's a nice, smooth transition back into productive community living.
Okay, is this drug and mental, or is it mainly on the drug side of things? Drug addiction, I should say.
It is both.
Right.
It is both together. Anything that puts the person in danger,
right,
in harm of themselves or of others.
Of others. Now, we touched very briefly between this 30 and 90-day commitment. Mm-hmm. Who determines that time limit?
Basically, it's up to that person and the progress that they're willing to make. If they're involved and engaged, then their time will be shortened. And if there's other things that they need to work through, that time may be extended. What
happens when someone is released? Now, you said before that it's a slow process. Explain that, if you can, a little bit more deeper.
Yeah, in a perfect world, staff at the institution where they're at contacts the local community mental health center, and we have staff whose job is to call the institution and essentially have a conversation with the individual who's there and do a warm transfer from there back into the community.
How often will that person be seeing a counsellor after the process?
That is basically up to that individual. Mm-hmm. Usually at least once per month, twice a month.
Okay, thank you so much. I want you to come back. We have lots to talk about.
Yes.
Such an important part of our community.
Thank you.
If you want to find out more information, there's all that information up on the screen for you. Give them a call. They're going to support you. Back after this short break.